Hey everybody, Dr. Rob Silverman here. Happy Wednesday. I'm excited to share some interesting information. Was working on one of the chapters in my book and was having a couple of beta readers look at it. And we were talking about stomach acid and they brought up the point about PPIs or proton pump inhibitors. And they were like, you didn't talk about this and you're talking about stomach acid and leaky gut and things of that nature. So it really stimulated something in my head to get a closer investigation. And I ran to the office and I was looking and I was realizing how many of my patients and how many of you out there are taking these PPIs. And when you really look at the data, you realize these are one of the most overused over-the-counter drugs, one of the most prescribed drugs, and one of the most deleterious drugs for overall stomach health, leaky gut, SIBO, and the like. So I wanted to share some insight on PPIs with you today, what they are, how they damage you, how they mix with other drugs. And Friday, I'm going to come back and I'm going to give you a part 2 on the natural supplements for GERD, acid reflux, and the like. So with all that being said, let's start digging into some of the more interesting information on the PPIs. They're a 24-hour antacid pill. Actually, as I just said earlier, they're one of the most commonly filled prescription medications in the US. When you combine that with being available over the counter, you realize so many more people are taking them than are recorded. They are, I think, when I looked in 2019, the 8th most prescribed drug. You add that over the counter, and one doesn't know. They were probably in the top 3 without question. Now, they suppress stomach acid. They suppress stomach acid, and this suppression of stomach acid can cause a B12 deficiency, kidney disease, and can increase the risk of dementia. And they do so because, as we all know, and we've talked about before, the gut and the brain are intertwined. They're bidirectional. So whatever you do to your gut, you do to your brain. Any kind of damage to your gut, you're going to have damage to your brain. So let's talk about some of the more common causes of low stomach acids. But I do want to highlight one clinical gem. Most people who have this acid reflux, most people that have these issues with GERD, they really think it's because stomach acid is too high. And in almost all instances, its stomach acid is too low. So you're going to take one of these PPIs, an acid blocker, and you're going to decrease it even lower. But there's some common causes of low stomach acids. Number one, or one of the top ones, is magnesium deficiency. It's the most common cause. Now, magnesium is a critical mineral. It's a critical mineral in that most Americans are deficient in magnesium. Magnesium partakes in over 300 enzymatic reactions. Magnesium is a critical mineral for all of us to take. Many people need the magnesium for muscle tone, to break up muscle spasms. And magnesium really works great, as we all know, with calcium to provide a relief at night and get some rest. High cortisol from stress. Now, we live in a very stressful time. It actually can lead, that high cortisol can lead to an 80 to 90% reduction in stomach acid. Now, we're going through a health pandemic. I have some things going on at home personally, not in my house. My parents, there's some issues there. Everybody has stress. Seeing patients, been busy in the office. There's a lot of stress there, mental health stress, things of that nature. Because of stress, people eat under stressful conditions. They have poor eating hygiene. They eat really fast. They don't break the food down. The 32 chews per bite of food and things like that. Another leading cause of low stomach acid would be H. pylori infection, which is an overgrowth of bacteria in the gut. And last but not least, of course, hypothyroidism. Now, what's interesting, and how do these PPIs work? They reduce the production of acid by slowing down the work of the parietal cell in the wall of the stomach. So they're very damaging in that manner. And as we all know, they are commonly prescribed for the treatment of heartburn, acid-related disorders, and they are actually thought of to prevent gastric acids. So one of the most over-the-counter drugs, if you will, would be Nexium. So once again, I want to make this point. I want to make this salient point that they're very highly prescribed. They're very used over the counter. And many of us You and I don't, but I'm just saying you and I, it's very conceivable that somebody listening right now is taking them, and it's without question for the practitioners conceivable that your patients are taking these things, and it's something that we need to address, especially as alternative doctors every day. There are a couple of studies that I wanted to go over that I thought were really poignant. In that this was from Gut 2016. It talked about PPIs affect the gut microbiome. And essentially, the differences between PPI users and not users was clearly observed in that those who were users had a less healthy gut microbiome. As a matter of fact, using PPIs predisposed many patients to an increase in C. diff and increased the risk of enteric infection and intestinal infection. And they stated once again that PPIs are one of the most commonly used drugs. In a similar study, or a follow-up in this study, PPIs were used and they actually decreased the bacterial richness and had this not only profound in gut microbiota, they increased the pathogenic bacteria in the gut. And on a population level, they damaged PPIs, the gut population, more so than antibiotics or any other drug. Any other drug. So the population is a problem, and also the balance in the population in bacteria, because we're made up of a bacteria. There's, you can add zeros to how many more bacteria than there are human cells in the body. When you get an unleaveling of good and bad bacteria, it's called dysbiosis. Dysbiosis, unfortunately, you need to avoid dysbiosis about 85% good bacteria. So there's a lot of facets to the idea of what dysbiosis does. So in a 35,000-foot view, the first thing that we worry about is leaky gut, damage where we get increased intestinal permeability. The second step is dysbiosis. The third and probably worse outcome to leaky gut is called endotoxemia, when we have something called LPS that's expressed, goes through the gut, gets into the bloodstream, and it can cause systemic inflammation. PPIs are involved in a lot of these different things. Once again, PPI users, interesting, they actually had 20% altered issues compared with those of non-users. Antibiotics, antidepressants, and statins were associated with distinct gut microbiotic signatures. Is this a question?
Yeah, it's in your question.
Okay, so I see that I'm getting some questions, but not a problem. We're going to get to the questions momentarily. So I really wanted to make that point again. We have a lot of people handing me stuff. We always want to give you the information. Hang on, we're going to get to the questions in a couple of minutes. I promise I'll address all the questions. Now, interesting, again, antibiotics, antidepressants, and statins are associated with distinct gut microbiota signatures. All these medications can damage the gut. Now, when you combine them all, or combine more than one of them with a PPI, you're really going to have a ruinous outcome in gut health and gut performance. What was interesting is also in another study, it showed that there was not only a lower abundance in gut commensals. Now, I've always used the term gut commensals. Commensals is what's supposed to be there. They're not eating, they're eating food in the habitat. They're not actually eating the habitat. But what was most interesting about the studies with PPI, they did it with 70 twins. And this was a huge takeaway for me. So what they found out was the results were replicated. Everything that we set up to now were replicated in 70 twins who were discordant for PPI use. So the twins who have virtually the same identical microbiota had the same outcomes. One was good, who didn't take it. Yeah, good bacteria, good gut outcomes, versus those who took it that were bad. So I don't know if you can get two more identical people than twins. And once again, we're really seeing that the studies over the last 3, 4, and 5 years are really speaking about the overuse of these PPIs really damaging our gut microbiome. Now, what's most interesting, or maybe disconcerting, if you will, is the FDA recommends PPIs should be used anywhere from 4 to 8 weeks. So they should be done in 8 weeks. There's an estimated 15 million Americans right now are taking PPIs regularly to control the symptoms of acid reflux. The problem is many have taken their PPIs for months, years, some even decades. A study from the British Journal of Clinical Pharmacology, January of 2017, spoke about the increased risk of C. diff. We had said it before, it's about 1.7 times the increased risk and 3.7 times the increased risk of Camplio infections. So as you're seeing, it's not just unsettling the environment, it's actually perpetuating, if you will. Hold on, let's make sure we don't do that again. Perpetuating the idea of infections in the gut. There was a 2016 Australian study where they looked at more than 38,000 adults, all over 45, who used PPIs. They had an increased risk of hospitalizations for infectious gastroenteritis, and the patients who had chronic bowel problems had even a greater risk. Really no surprise there. There is a review of 19 articles found, because when I looked at this, I really wanted to get a data-driven statement. And I looked at PPI facts, gut health, and SIBO, small intestinal bacterial overgrowth. Now, one thing I'd like to say about small intestinal bacterial overgrowth is, just like leaky gut had captivated me 25 years ago and really captivated more of the general populace in the last 5 years, I believe that SIBO will be the conversation piece for 2021 and beyond outside the bubble of functional medicine. So when we look at all those articles, the PPI use was associated with a 1.71% greater prevalence of SIBO. You don't want SIBO to begin with. You certainly don't want to increase your risk of SIBOs. It was concluded that PPI use increased that risk of SIBO. And here's this vicious cycle. The conclusion was SIBO caused reflux and increases the need for PPI. In turn, PPI lowered stomach acid, which exacerbated SIBO. I've got an upcoming live that I'm going to bring in a SIBO expert. And it's a good friend of mine, Dr. Lauren Marks. He was on about a year and a half ago, but we had some good updates on SIBO, and we're going to banter it about. So if you have any questions, send them in advance. And I promise you we're going to cover them because you're going to really want to know, and you got to hear what this doc has to say. And I'd like to continue with the idea of PPIs and non-steroid anti-inflammatories together promoting damage to the mucosal lining in the gut. What they found out was that in the gut, PPIs were bad, NSAIDs were bad. When you put them together, not only were they bad for the gut lining or worse in combination, but the issue also led you down a path of damage to the liver because there's a gut to liver axis, and it became very prevalent when you took NSAIDs and PPIs. And lastly, I had talking about it with a friend of mine. They had recommended that I include the histamine 2, or what we call the H2 blockers. They are also acid suppressors, and they are an H2 receptor antagonist, and Tagamet is a great example of them. So I do want to leave you with some lifestyle suggestions. I will be back on Friday where I'm going to go over supplements. I'm going to do the lifestyle recommendations. I'm going to ask you questions. So an anti-reflux lifestyle recommendation, real simple. It always goes back to the same thing. Get rid of that quarantine 15 if you can. Get rid of that extra weight. You want normal weight and good body composition. You always want to avoid smoking. Smoking is without question damaging to your overall health. It's damaging to your spine. So you want to avoid smoking. Try and get some exercise. 30 minutes a day. There's a multitude of ways to exercise. There's weight training, there's cardio, there's flexibility. 30 minutes for everybody is not too much to ask. I'm a coffee guy. Everybody knows I'm the science officer of Fit Grinds, got a great coffee, but I do recommend limiting non-organic coffee and some non-organic teas as well. And please, always eat a health-oriented diet. Those are great choices. Whole foods, not too much sugars, not too much crappy saturated fats. Don't eat any processed food. Those are the things that are going to, without question, not enable you to have a health-promoting day. So we've got some questions now. So let's see. Hey, Candace, how are you, Doc? Good education, important. Thank you for educating on this, Dr. Up. Thank you. Thank you for listening. Please feel free to share this with everybody. Hey, Margarita, dangers of wow, you guys gave me omeprazole. Okay, well, I wrote it down here because I had seen it used to treat certain stomach issues like esophagus problems, etc., etc. It's an over-the-counter, so I would try and avoid I would try and avoid a lot of these issues. To answer your other question, activated charcoal, great choice. Always love the activated charcoal. Hey, Doc, Joe James Tilley, my good friend. I appreciate the information that you, or at least you like me sharing the information. We do this all the time. Love fit grinds. So somebody always asks, how can I get fit grinds? We can go to fitgrinds.com. We've got 3 specific coffees. We've got a focus, great for brain focus. Excellent. We also have a pre and a probiotic, and we also have a collagen, and we're coming out with an immune function real soon. So fitgrinds.com, and just let everybody know you saw me here, and see what we can do for you. It's been a brainchild of myself and my partner, Brent Geltz. Is there a specific test for testing low stomach acid? You know what, Sarah? There's a multitude of tests, but I can tell you this. A lot of questions on tests. There are a lot of different tests. So what I'll do is I'll put up, Steph, we'll put up a couple of the tests so everybody has it and where they can get the tests. I love coming online and seeing you live. Love the energy. I appreciate it. You know what? Greatest job in the world. You know what? You prepare. You want to share information. Sometimes you have to put all the information together and rush a little bit because it just came out last night or something like that, or it hit you, but you do want to share. You're welcome. You're welcome, Margarita. All my pleasure. Well, it's been my pleasure. All I can do is ask you, please do me a favor. Comment, like, share the information. We'll be back on Friday. I'm going to go over the supplements. I will post what low stomach acid tests I recommend or what to do. It's been my pleasure. Dr. Rob Silverman, always yes in health.